Definitions. Proctosigmoidoscopy is the examination of the rectum and may include examination of a portion of the sigmoid colon. Sigmoidoscopy is the examination of the entire rectum, sigmoid colon and may include examination of a portion of the descending colon. Colonoscopy is the examination of the entire colon, from the rectum to the cecum, and may include examination of the terminal ileum or small intestine proximal to an anastomosis. Colonoscopy through stoma is the examination of the colon, from the colostomy stoma to the cecum, and may include examination of the terminal ileum or small intestine proximal to an anastomosis. When performing a diagnostic or screening endoscopic procedure on a patient who is scheduled and prepared for a total colonoscopy, if the physician is unable to advance the colonoscope to the cecum or colon small intestine anastomosis due to unforeseen circumstances, report 45,378 colonoscopy or 44,388 colonoscopy through stoma with modifier 53 and provide appropriate documentation. If a therapeutic colonoscopy Captain Code 44389, 44407, 45,379, 45,380, 45,381, 45,382, 45,384, 45,388, 45,398, is performed and does not reach the cecum or colon small intestine anastomosis, report the appropriate therapeutic colonoscopy code with modifier 52 and provide appropriate documentation. Report flexible sigmoidoscopy Captain Code 45330, 45347, for endoscopic examination during which the endoscope is not advanced beyond the splenic flexure. Report flexible sigmoidoscopy Captain Code 45330, 45347, for endoscopic examination of a patient who has undergone resection of the colon proximal to the sigmoid, e.g., subtotal colectomy, and has an ileosigmoid or ileorectal anastomosis. Report pouch endoscopy codes Captain Code 44385, 44,386, for endoscopic examination of a patient who has undergone resection of colon with ileoanal anastomosis, e.g., J-pouch. Report colonoscopy Captain Code 45378, 45398, for endoscopic examination of a patient who has undergone segmental resection of the colon, e.g., hemicolectomy, sigmoid colectomy, low anterior resection.